connection to this phone.
तो start करो.
इसको
Zoom meeting.
हाँ
Zoom meeting.
Zoom मीटिंग को थर्ड या फोर्थ टाइम स्टार्ट
ये हमारे साथ भी होता है यार.
now just so I'm sorry for this confusion. There was some problem because of which audio was not getting connected. So now let us continue our discussion. Yesterday, we were trying to understand about the critical components connected with the anatomy and physiological functioning of the reproductive system of women, and in that connection, how the different organs play an important role and how the physiological functioning takes place. We try to discuss about that. So far we have completed our discussion about seven lessons, And as part of seventh lesson itself, we are going to discuss about the common gynecological problems. So, what can be the possible gynecological problems usually faced by women? So, in this also, the first part we discussed yesterday that it includes menstrual disorders, which can include painful periods with severe cramps, or it can also lead to heavy menstrual bleeding. Infrequent periods can also be one of the challenges for young women or elderly women also who are still in the reproductive age. And then absence of menstruation, like if the menstruation cycle doesn't get initiated in the adolescent stage, that may lead to a lot of another set of challenges. And then we also have severe mood fluctuations connected with the problems of menstrual cycle. So it's not that all women will face the same symptoms. The symptoms will vary from time to time and from place to place as well. Then, apart from the menstrual disorders, the other critical gynecological problems which women might face include infections, sexually transmitted diseases, and endometriosis. So, what happens in these infections? Even this is of different types of infections which women can be prone to. It includes vaginitis, pelvic inflammatory diseases. So, in vaginitis, what is happening? The reproductive organ of the internal reproductive organ of women, vagina, it gets inflamed due to various infections and bacteria like bacterial vaginosis, yeast infections, and trichomoniasis. So the cause of infection can be multiple. There can be various kinds of infections, various kinds of bacteria which might impact the gynecological functioning of women, because if these infections are not treated on time or if they are delayed, then it will lead to another set of complications. Then pelvic inflammatory diseases, it includes infection of female reproductive organs usually caused by sexually transmitted infections. So sexually transmitted infections definitely cause sexually transmitted diseases. So when we are talking about sexually transmitted infections, HIV is one of them which you all are familiar with. So this also is the result of practicing unsafe sex between the partners. So, sexually transmitted infections can include HPV, human papilloma virus, which can lead to genital warts and cervical cancer. So, you might have heard that there are also several vaccinations which are present with regard to HPV, human papilloma virus, etc. And then you also have another infection, which is chlamydia, often asymptomatic, like immediate symptoms will not be there, but can cause serious reproductive issues, probably in the conception of the woman, if the woman wants to bear the child, and there can be challenges in that also. Gonorrhea, which can lead to another set of infertility if it is untreated, and herpes simple virus, which causes genital herpes. Usually, herpes is also kind of a skin infection, like the symptoms are on the skin, but it can also be related with your nervous functioning also. So, herpes can also be, this is with exclusive reference to genital herpes. Then there is a condition called as endometriosis. It is a condition where tissue similar to the lining inside the uterus, which is we have discussed that inline uh, inside lining of the uterus is called as endometrium. So it starts to grow outside the uterus, causing pain and potentially affecting the fertility. So this growth of endometrium can be due to various reasons. It can be due to multiple factors. So, all these factors can play an important role with regard to women's gynecological health, and if these concerns not addressed on time probably can lead to another vicious circle of challenges. Then, apart from menstrual disorders, infections, sexually transmitted diseases, endometriosis, there can also be challenges connected with fibroid. So, fibroid basically is a kind of a non cancerous growth in the uterus that can cause heavy menstrual bleeding, pelvic pain, and pressure symptoms. So, fibroid is also detected using the ultrasound, and most of the fibroids, they are again non-cancerous in nature, but it causes lot of inconvenience because of excessive bleeding, menstrual bleeding, and excessive menstrual bleeding again can lead to a set of challenges connected with loss of hemoglobin, loss of blood in the body, and that will have its another set of consequences and impact. Then we also have what you call as polycystic ovary syndrome. So it is a hormonal disorder which causes enlarged ovaries with small cysts on the outer edges, leading to irregular menstrual cycles, infertility, acne problems on the skin, and excessive hair growth. So when you talk about fibroid, polycystic ovary, or ovarian cyst, these are not fatal challenges for women, but definitely the kind of impact what it has on day-to-day functioning of women, that is definitely intense, and it seriously needs to be addressed on time. So, like for example, if like a woman is trying to conceive, a couple wants to have a child, and this condition of polycystic ovary syndrome is prevailing, then this enlarged ovaries, when the ovaries, which is an important organ in the female reproductive system, so when the ovaries get enlarged with the smaller cysts outside, then naturally it leads to a major challenge in conception. And apart from that, ovarian cysts, so fluid filled sacs on the ovary. So, like polycystic ovary syndrome is basically on the outer edges with enlarged ovary, whereas in ovarian cyst, what is happening? It is a fluid filled sacs on the ovary. While often harmless and symptomless, they can sometimes cause pain and other issues. So, some of the conditions connected with the gynecological challenges of women, immediately might not show direct explicit symptoms, but they have their respective impact. Then we also have a condition called as cervical dysplasia. So abnormal changes in the cells on the surface of the cervix, often detected through pap smear, and can be precursor to cervical cancer. So this is also one of the types of as we have mentioned, it is a kind of a precursor, it is a kind of a condition, probable condition. It's not that always cervical dysplasia can lead to cancer, but sometimes cervical dysplasia can also be a precursor, a earlier condition to cervical cancer. So in this, what is happening? The abnormal growth of cells in the cervix area takes place, and to detect such kind of health conditions, the diagnosis is possible through pap smear test. Then we also have a condition called as uterine prolapse. So in uterine prolapse, it is a condition where uterus descends from its normal position into vaginal canal, often due to weakened pelvic floor muscles. So when the pelvic floor muscles gets becomes weak, then it might lead to a condition where uterus will move from its normal position and might go towards the vaginal canal. So this also has its respective consequences. Urinary incontinence is a problem which is not always necessarily only with women. It can also be there with men, but most of the times it is the women who is suffering with this kind of a challenge, which leads to loss of bladder control. So there is a kind of dripping and control on urine is not there, and it can be related to pelvic floor disorders. Then menopause and perimenopause. So the transition phase before menopause, which I mentioned in yesterday's class also, friends, that the beginning of the menstrual cycle and the beginning of the menopause. In fact, menopause is not a one time result. There was some problem, was disconnected. Let's again reconnect. So challenges with the technology happens, we don't have to worry. By now, most of you might have got used to this kind of gaps in technology. So it happens. So as I was mentioning, menstrual cycle and menopause. So menopause is also a process. It is not a one-time event. It takes some time period for it to occur. So the transition phase before menopause, perimenopause, okay? So when the body is preparing uh, itself to reach that stage of menopause and the cessation of menstruation. So the moment menstruation cycle is stopping, it is cessation. That stage is called as menopause. So it also takes place over a period of time. So women might experience excessive bleeding, women might experience irregular periods, women might experience other physiological changes also in the body in terms of more sweating or loss of appetite. It varies from women to women. So perimenopause, which is a stage before the onset of the menopause, and the menstruation cycle. So all this brings about several hormonal changes that can cause a variety of symptoms, including hot flashes, vaginal dryness, and mood changes. See, vaginal dryness is also one of the reasons for vaginal infections also. So that is why, like women who have experienced menopause completely, first they have this challenge of vaginal dryness, sexual intercourse becomes a challenging task, it becomes a painful task. And that is where certain, if the sexual intercourse between the couple, between the partner has to be still continued, then some external application of cream or other ways of ensuring lubrication of vagina has to be taken care. So vaginal dryness is one of the important conditions after a woman has attained the menopause. Mood changes, because we have to remember that all these things is associated with lot of hormonal changes, hormonal imbalances in the body, and that is why mood fluctuations can be multiple during the menstrual cycle and when the menopause is in the process. And we, as a country, we all are concerned about increasing number of cancers, whether it is exclusively women organ related cancers, or it can be generic cancers or exclusive male related cancers. So apart from our lung cancer, liver cancer, blood cancer, or cancer in any part of the body, which can happen to any gender, male or female, but there are exclusive kind of cancers which is associated with the reproductive organs of women. So women can suffer with cervical cancer, cancer in the uterus or ovaries, cancer of fallopian tubes, vaginal cancer, or even vulva cancer. So, in many cases, if the women is in non-productive, uh, sorry, non-reproductive state, then doctors also go ahead with the removal. Now, for example, if you're talking about breast cancer, so if it is in a very advanced stage, the treatment can also involve removal of the breast for that, removal of cervix also for that matter. So, depending upon at what stage the cancer is, and depending upon what is the age in which the concerned patient is or the person is, medical decision is taken accordingly. Now, so far we have discussed, if you see our contents, we have tried to understand total of 7 units ranging from vital statistics and demographic parameters of women, health status, to what is the concept of balanced diet and nutrition, nutrients in the food, then what are the dietary requirements during pregnancy, lactation, and older women, what can be the common nutritional problems which women might face, and what are the different nutrition programs for women and children, and the latest unit where we try to understand about anatomy and physiology of reproduction and common gynecological problems. Now, we will go further and do our discussion on pregnancy and related problems. So, friends, as we are aware that pregnancy is one of the important stages in life of any woman, because that is a life-changing process and life enhancing process, and a very, very critical process which has tremendous bearing on a woman's physical health and also mental health. And probably life is about to change completely post pregnancy, because now a woman as a mother becomes the primary caretaker. So, whenever we are talking about that 9 months of pregnancy, and in some cases, due to some complications, there can be early pregnancy also. But there are certain common problems, common concerns. If not problems, there can be certain common concerns which most of the women might face during the different trimesters of the pregnancy. So we are beginning our slide by saying that it is a very significant period in a woman's life, and lot of physiological changes takes place, and these physiological changes is inclusive of the hormonal changes which is taking place in the body. So some of the, by and large, with the more and more development of medical technology and medical assistance in today's time, though every phase of the pregnancy and every stage of the pregnancy of the women, there is a clear cut medical assessment. Still, there are certain common problems. So, when we talk about first trimester, that is between 0 to 12 weeks, there are challenges connected with nausea, or what you call as morning sickness. Then usually you might have heard people saying that as soon as the woman is becoming pregnant, that news should be given to others outside the family. Family members will, of course, come to know, but outside the family only after 3 weeks, because there is a relatively higher risk of miscarriage. So people say that, such kind of news should be broken after a period of almost 3 months has passed. So miscarriage, where spontaneous loss of pregnancy before the completion of 20 weeks of pregnancy. Then ectopic pregnancy. See, this is a very different kind of a condition where, see, in yesterday's class when we were discussing that after fertilization the egg is placed in the uterus, because it is only in the uterus where the fertilized egg gets all kind of environment for it to develop. So for that fertilized egg to become the fetus, and almost 9 months period inside the mother's womb, that condition is provided only by the uterus. But unfortunately, in ectopic pregnancy, what is happening is the fertilized egg gets implanted outside the uterus, usually in the fallopian tube. So fallopian tube will not have so much of expansion for the fetus to develop, and for the right kind of environment for fetus to get all kind of nurturing through what mother is taking. So this can also be one significant condition. Then hyperemesis gravidarum, which is severe nausea and vomiting requiring medical attention. Sometimes like morning sickness can be normal thing, and sometimes it can be a very very serious nausea condition where it will require medical treatment. And as we are familiar that during pregnancy stage we are expected to avoid unnecessary medication, and self medication has to definitely be stopped, because what kind of medication one is taking and what impact it can have on the mother and on the child. That is why every medicine should be under doctor's prescription, doctor's supervision. And then gestational trophoblastic disease, molar pregnancy. So abnormal growth of cells inside the uterus after fertilization. So fertilization has taken place. Egg has been after fertilization, the egg is there in the uterus, but along with that, certain abnormal cells also develop in the uterus. So all these conditions can be detected through ultrasound also. So in second trimester, that is between 13 to 26 weeks, usually what kind of concerns can arise in this time period? So it includes gestational diabetes, so high sugar levels during pregnancy, then preeclampsia, where high blood pressure. This is one serious condition among women, and because of this condition connected with high blood pressure, it will have a direct bearing on the child, and child, not only mother, of course, on mother, but also on child. So that is why very, very efficient monitoring of sugar levels and blood pressure becomes mandatory. So, high blood pressure and signs of damage to another organ system, often the kidney. So, this is not that every pregnant woman has this, especially women, those who already are diabetic, those who are already hypertensive, they might also develop the tendency of higher levels of sugar in their blood. They can also have the tendency of becoming more hypertensive. So these kind of conditions has to be constantly monitored and regulated. Placenta previa, where placenta covers the cervix, leading to bleeding and complications during delivery. So sometimes you might have heard that during pregnancy, probably it is this condition. I'm not a medical expert, but depending on what my general awareness is, we have heard conditions whereby, the placenta also gets tied up around the neck of the baby, just born baby, or probably the baby is in the process of coming out. And in that case also, supply of oxygen can be interrupted, and that can also lead to lifelong disabilities among the children. So that is why pregnancy is definitely a experience of life for a woman, for a mother, but also it is filled with lot of risks and lot of concerns at every stage for both mother and also child. That is why it becomes very, very important to take proper care in terms of diet, in terms of activities, in terms of important parameters like sugar, blood pressure, and other kinds of conditions. Then preterm labor, labor that begins before 37 weeks of gestation. So sometimes that labor pain can be false alarm also. Sometimes it can be serious labor, and then medical call has to be taken that what has to be done in such kind of a condition. Because before 37 weeks of the gestation period, if the woman is going into labor, then how it will impact a childbirth. So in such cases also, cesarean is one of the options which doctors usually opt for. Then intrauterine growth restriction, the baby grows slower than expected in the womb. So these are some of the important and critical pregnancy related problems which women suffer. Now in third trimester, what is happening? Preterm labor. So before 37 weeks, this can be one challenge. And can preeclampsia, which is being hypertensive, high blood pressure, that can develop in third trimester also. Gestational hypertension, placental abruption. So placenta detaches from the uterus wall before delivery. So if that is happening, then probably all the feed to the child also gets impacted. Then there is also a concern called as oligohydroamnios, where amniotic fluids inside the mother's womb, they become very, very low. So if these fluids are reducing, then the right kind of environment which the child needs, which the fetus needs for its nurturing, that also gets impacted. And the reverse condition. So in one condition, the amniotic fluids will reduce, and in another condition, amniotic fluids can increase. There can be excessive amniotic fluid also. Then breech presentation, the baby is positioned feet first or buttocks first instead of the head first. So uh, if the positioning of the fetus in the mother's womb is slightly disturbed, then the way how baby's position is taking place while coming out of mother's body, that also becomes something that also becomes a critical concern. So apart from this pregnancy related concerns during the 3 trimesters, at a general level, there can be complications connected with anemia, like the mother can have low hemoglobin, less RBC count, urinary tract infections in pregnant women, then thrombophilia, increased risk of blood clots, which can affect the placenta, then RH incompatibility. So occurs when a mother with RH negative blood type is pregnant with RH positive baby type. So if mother's blood group is, let us say, O negative, and the child's blood group is A positive, then RH incompatibility is there, that also impacts the child. So such conditions can also be taken care by proper medical advice, and proper medical advice and medications are available to address such kind of conditions. Multiple pregnancy, if a woman is carrying more than fetus, so though there is a pleasure of having twin children, but of course the challenge also can be uh, more, and more than one fetus, and there is more risk of preterm labor and other kinds of complications. It need not be so all the time. It happens in many women. So that is why we are discussing this as part of our lesson. Now, pregnancy has pregnancy period has been completed, childbirth has taken place, and before I talk about postpartum, means after pregnancy, immediately after pregnancy, I just want to have a quick overview of what is mentioned in your syllabus. So, as part of this particular unit, there is reference about normal pregnancy, where normal delivery takes place, and in this connection, it is very important for us to remember that sex determination test is illegal and like we have prenatal diagnostic techniques regulation and prevention of misuse act 1994, and as part of this act it is prohibited, it cannot be communicated, the doctor cannot communicate what is the sex of the fetus to the woman, to the pregnant woman or to her family. Okay, so this is one very important piece of information which has been mentioned as part of your syllabus. And then, normal pregnancy, it also becomes very important to keep a track of weight, height, blood pressure, which we just discussed, urine analysis for albumin and sugar. If the pregnant woman is having high levels of sugar, then that also gets not only detected through blood test or even sugar traces are protein traces or albumin traces are also found in urine examination and clinical examination for anemia and hemoglobin levels, and of course, abdominal and a pelvic examination, which is a routine part and a periodical part of any pregnant woman. A complete physical exam, heart and lungs are also included because now there is pressure on the woman. She's carrying the womb also, and in your material also, trimester wise discussion has been given, which will help you to understand more in detail. Now, in case of normal pregnancy, usually the labor pain can be induced on its own, or sometimes if the period has been completed and woman is still not getting the labor, then labor is also induced with the help of injections. So it is very important that in labor also there are different stages which has been explained in your material at length, and because of the paucity of time, the entire details might not be possible for us to do it. So, as part of labor, just to give you a broad understanding, so the first contraction of labor pain or labor when it is induced are irregular and fairly mild. The second stage begins when the baby's head is ready to emerge from the fully dilated cervix and ends with baby's birth. So, second stage is probably stage of intense pain when it is a normal delivery. And then in the third stage is the delivery of the placenta. So in this, what is happening? Sometimes after the baby has been born, uterine contractions begin again, this time to expel the placenta that was baby's life support through the pregnancy. So this labor also has different stages. So the second stage is the most important stage, not to say that the first and third are not important, but it is usually during the second stage when the baby's first, if the positioning of the baby is appropriate, then first the head comes out, followed by the remaining body of the baby. And there can be complications in pregnancy. There can be bleeding during pregnancy, excessive bleeding during pregnancy, and that is why all kind of support system is maintained uh, by the doctor when and where required. And there is also discussion about ectopic pregnancy in your material. And sometimes, there are conditions connected with there is a condition which has been mentioned in your material, which talks about antepartum hemorrhage due to premature separation of the placenta, also called as accidental hemorrhage. So, as I mentioned, my dear friends, placenta is the entire support system for the child. So, if the placenta is getting separated from the child, then all the possible nourishment to the child is lost, and that can have very, very serious consequences both for the life of the child and that of the mother. And there is also a condition which has been mentioned in your material, that of a shock. Sometimes, probably due to acute pain or probably due to some internal concerns, the blood pressure of the pregnant women at the time of delivery can increase to a great extent, which can lead to conditions of shock also for women. And apart from these things, like cesarean section, we are familiar. If the physiological and physical health of the mother is not supporting, then doctors will always advise to go ahead with cesarean section. And today, most of the women are also preferring that cesarean section because they don't want to have that pain connected with the inducement of labor. But again, it has to be borne in mind that cesarean also has its set of implications. So, depending of the decision of a normal delivery or C-section is completely a medical decision which has to be left to the doctor. And your material has given a detailed analysis of like what is the medicines which has to be taken during the pregnancy. I will not be in a position to discuss this in detail, but your page 128 and 129 is clearly mentioning about different medicines and or like possible effect of medicines taken during pregnancy and lactation on the fetus and the newborn. So that is what we have been discussing, that self medication is a big no during pregnancy. So your material is definitely talking about this, and I would request you all to kindly see that page more thoroughly, not only for our self awareness but also to spread awareness in our network, in our neighborhood. If people out of ignorance are consuming some medication, some kind of a painkiller or some kind of sedatives for some condition, some other condition, but it can have very serious impact on the mother and also on the child. So self medication has to be thoroughly avoided. Then apart from this entire list of medication, there is also a section connected with like after now the childbirth has taken place. This is what postpartum I will be talking about. So now see, 9 months of pregnancy, then the delivery. If the delivery is through normal delivery, in that case also, or if the delivery is through cesarean also. So in cesarean, because long term, it is surgery, so long term care is required, and irrespective of whatever type of delivery one is, one very important part is how to take care of the child. So usually, because that is the stage where the woman's body is physically exhausted. Of course, she's very happy and content to give birth to another life. But again, there is entire process of how to start beginning to feed the child. Okay, so in this also, like some like elderly say that the initial slightly yellowish color milk should not be given to the child, but now it has been medically proven that that is the best immunity support to the child, because child will not drink water. Child's entire sustenance is on mother's milk. So it usually takes some time, because even that also is hormonally induced, right? So hormones should play its appropriate role so that the mother is also having the milk so that she can feed the child. So that might not happen immediately, usually after the delivery, For many women, it will take 1 or 2 days time. For some women, it takes 3 to 4 days time, but usually it happens in 1 or 2 days. And for that also, the elderly women in the family, they will give the just delivered mother some kind of homemade things which has a better possibility to increase the milk in the breast so that the child can be fed appropriately. Now, here, after delivery, one very important concern is postpartum. Like after delivery has taken place, the child has come out. Now the bleeding has to stop. If the bleeding is excessive, that can lead to another set of challenges. And now let us say now physically the mother is okay. Postpartum depression is one very serious concern which is being spoken in today's time at a very massive scale. It's not that earlier postpartum depression was not there. Even earlier it was there, but our support network, our social network was also different. And probably even if women were undergoing, they were not very vocal about it. But today, when we are talking about, women's health rights and things like that, after delivery, women undergoes that kind of depression. So in some cases, it can be short-term depression, some cases it can be long-term depression, and that has to be taken care appropriately. If required, a counseling or psychiatric help is also must be taken. Then infections, where endometritis can be one possible infection, breastfeeding issues. So, like if there is infection in the breast tissue of the mother, then how the child has to be fed and difficulties with latching. So these are the challenges connected with postpartum, and it is very important that uh, pregnant women, if they are diabetic or hypertensive or obese, these additional challenges come during pregnancy. So care has to be taken on these very important dimensions of general physical health of the woman. Then, if women at a higher age, like 35 or 40 plus, but nowadays because women are getting married late, they are also getting educated, they have their career plans, and that is why postponement of delivery, that has become a common phenomenon in today's time. But again, see, when the delivery is being postponed and keeping in view the kind of environmental pollution, environmental challenges which is already exhausting our body, delaying further the age of pregnancy will have its own set of concerns and complications. Lifestyle factors, if one is alcoholic or one is a chain smoker, or if the diet is very poor, even that will impact the pregnancy conditions. Multiple pregnancies. See, like, many times there can be frequent abortions, multiple pregnancies in short period, or twins, or there are, though there are rare cases, but there are cases of 3 children born at a time, and rarest of rare is quadruples, 4 children being born. So multiple pregnancies can also have its set of concerns. But one good thing is what, my dear friends, that medical technology has advanced to such an extent that you are in a position to, do this assessment whether there is one fetus or two fetus, whether there are twins or whether there are 3 kids in mother's womb. And the advancement of medical technology has definitely provided lot of support to the entire process of pregnancy. What is required here is to be careful, to plan a pregnancy, to have balanced diet, to maintain good hygiene. And one very important concern is with, like, if the woman is pregnant or after pregnancy, whether sexual intercourse should be uh, done or not. So in this, again, the answer to this question, there is again no one umbrella answer in terms of yes or no. Usually, if the delivery is cesarean delivery, doctors usually prescribe 3 months because the woman's body has to heal completely. And during pregnancy, sexual intercourse or not, that also completely depends upon the physical health of the mother. If she is having some conditions which requires her to be completely on bed rest and avoid all kinds of exertions, so in such kind of cases also, uh, all the care should be taken. So that is why, like with regard to sexual intercourse, there is no umbrella yes or no. The decision has to be taken by the couple, keeping in view the physical health of the pregnant woman. So these are certain important topics which we have discussed as part of pregnancy and related problems. And then we have another, because this we have already, this topic we have already spoken just now, bleeding during pregnancy or shock if the hypertension has increased to a great extent, and if there is excessive water around fetus, even then there can be problems. I'm sorry, this slide has been repeated, but what is very important is being aware. See, when you are aware of the entire process of the pregnancy, what kind of concerns arise during these 9 months and after 9 months also. Now, thanks to information and communication technology, so much of information is available, authentic information is available. There are so many clinical websites, okay, which give us information. And it is not that that information is only in English. Thanks to Google, there are so many language translators. So it is always good to be, informed and be aware because being pregnant or becoming parents, becoming, see, though again, all the onus lies on women, but it is a collective responsibility. And that is why pregnancy should also be planned, it should be enjoyed, it should be experienced. That entire experience of a parenthood that has to be enjoyed, and lot of responsibility, care, not only during pregnancy but after pregnancy also, because women's body gets exhausted, she needs lot of physical and mental care, and the child needs lot of care. And in this context, it is the entire family's response. I hope I'm not getting into moral lecturing mode, but see, these are very important concerns during pregnancy, and because our social institutions have undergone a lot of change, it becomes important for us to be aware of what it is and how it is. Now, friends, we go to another very important topic, birth control methods, which is a very significant topic in a country like India. Now, you all are aware that India is the most populous country in the world. We already have a population policy in place, but again, there are also discussions happening whether what has to be done with regard to population control. Now, this is a community level issue. Okay, this is a sociological issue or legislative issue. Apart from that, as a couple, as a partner, okay, if you have had first child and you want to have some gap of, let us say, 3 years or 4 years in the for the next child, so what can be the possible birth control methods? So the prominent ones which is mentioned in our material includes natural methods, barrier methods where we can have usage of condom, diaphragm, or spermicidals, and hormonal methods where oral pills to regulate the hormones can be taken or injections can be taken, intrauterine devices, or which is popularly called as copper T, or like sterilization. Like you now you have had two kids which you thought, or how many kids you wanted to have, you had, and now you are okay that okay, I'm satisfied with this. So usually one of the partners undergoes the sterilization, and in our country most of the times it is the woman who undergoes the sterilization. So it is tubectomy, so that surgery is called as tubectomy for females. and it is vasectomy among males. So we will continue our this discussion in tomorrow's class, friends. I'm extremely sorry that today for initial few minutes there was some hitch. My audio was not getting connected. Tomorrow we will continue our discussion on birth control methods and take our discussion ahead and go to a very interesting topic of common health problems among. So thank you all so much for joining me today, and I will see you all tomorrow with our discussion on birth control